All right, everyone. Apologies for the delay. Zoom and connectivity to other apps. Sometimes, there was an update, so who knows? Welcome, everyone. Thank you for joining us today, whether you're joining us live online or as you watch the recording later on. My name is Heather Schulte. I am the founder and director of Stitching the Situation, a collaborative project documenting and memorializing COVID-19 in the US, and I'll be talking more about that later. I'm joined today with Ruth and Mohammed Nasrullah, who founded and lead the COVID-19 Wall of Memories, a 501c3 nonprofit organization telling the story of COVID-19 in America. So the Wall of Memories is a scrolling virtual memorial that holds the faces, names, and stories of people whose lives were taken by COVID. Today, we're joining to mark the 5th anniversary of the World Health Organization declaring COVID-19 a global pandemic on March 11th of 2020. And we're gathering to remember these 5 years. In multiple ways, this virus has forever changed our world and continues to do so. While we are no longer in an officially designated emergency period, COVID is still with us. We're only beginning to learn about the long-term effects of the virus, and millions are living with long COVID and related conditions. And to date, we've lost over 7 million people globally per confirmed testing, though the actual toll is certainly far more. Who knows how many of us are actually today grieving these losses, and how do we account for what we're going through? Today, we'll be discussing 4 different efforts to memorialize the people whose lives were taken by the virus. As we get started, I encourage you to get comfortable. Our discussion involves loss and death today, so do what you need to do to take care of yourself. Maybe grab a warm blanket, take some deep breaths. You can have your camera on or off, whatever feels most comfortable for you. You can snuggle with a pet or do whatever else you need to take care of yourself. This meeting is recorded, so if you're feeling overwhelmed, know you can always exit the live stream and return as you are able to at a later date. The recording will be available on YouTube, and we will post a link via social media once it's live. So I am going to turn it over to Ruth Nasrullah so she can share with you a bit about their project, COVID-19 Wall of Memories.
Thank you so much, Heather. I really appreciate it. Yes, COVID-19 Wall of Memories has been almost a 5-year long project of me and my husband, Mohammed. It was his idea originally. So I'm going to ask him to start with the discussion of what exactly COVID-19 Wall of Memories is, a little bit about how it got started, and just how it works, so to speak. So, Mohammed.
Yeah. All right. So thank you so much, Ruth. The way it started, okay. So back in 2020, in January, February, and March, um, when COVID hit us, we would hear on the news about how many people are getting infected, how many people are getting hospitalized, and how many people were dying, and these were just numbers. And after a few weeks or a few months of this, I felt like there were the people behind the numbers were not being shared with. We would find folks in our community, teachers, nurses, doctors, who got contacted this disease and got hospitalized. Some of them died. We felt like we need to do something. And in May of 2020, when the number of people who died of COVID reached almost 100,000 in our country, we decided to do something about it. So we jotted down our ideas on what to do, and what came out was that we should build a virtual memorial similar to the Vietnam Memorial, but a little bit different because it's virtual, so we can add pictures and stories and have a place for people to leave messages. So we hired a website developer, and 6 months later, on January 4th of 2021, we had our official launch of COVID-19 Wall of Memories. And we have been, thanks to a lot of help from volunteers, we have honored and memorialized almost 24,000 people on this virtual scrolling memorial. In the memorial, if you're looking at it from your laptop, like I do, I can see about 30 pictures on this memorial. And under each picture, I can click on it and it takes me to their story and what they did, where they lived. And then below that story, there's a place for visitors and family and friends to leave messages. And we have found that people visit this memorial as if they are visiting a cemetery. They spend time on their friends, loved ones, stories, leave messages. Some of them even leave poems. So that's our COVID-19 wall of memories. We're telling the story of COVID here in the U.S., and our work continues to go. So that's all I have. Ruth, thank you.
Thank you, Mohammed. And I want to, since you mentioned people uh, leaving messages and that sort of thing, there's one woman who's, and I'm going to share her story on our website because she had so many messages left by her family members, and this is an example of the kind of thing I think that COVID-19 Wall of Memories can provide to people who are grieving. And especially, this woman died in 2020. And so, especially in those days when um, funerals sometimes were not held, when you had to say goodbye to your loved one through an iPad or a phone. So there's just a little bit of information here. I think it was her daughter who shared this story. So, and that included a poem, which I thought was a really beautiful addition because obituaries tend to be sort of the facts. There's often a little bit of a story about what the person did in terms of work or volunteering or taking care of their family. But something like a poem to me is really personal. And then her family added so many messages, saying, Grandma, I miss you so much, and that sort of thing. So this is one of the types of, I just wanted to point this out, is it's one of the things that COVID-19 Wall of Memories sort of achieves, which is giving people a chance to share their own loved one's story. And I will also actually share what the website itself looks like so that you can see. And Mohammed, while I'm doing this, can you just talk a little bit about, you mentioned the Vietnam Memorial, which is a wall. How is it that that inspired you to want to create a virtual wall to honor COVID victims?
Well, I have visited the Vietnam Memorial a few times, and it it's such a visual has a visual impact on you. The massiveness, the long list of names, and I felt like this is something that this pandemic um, is something that has it's kind of unique. I've never been through a pandemic before, and I felt like if we can memorialize and remember and honor these folks on a wall, and of course, we did not have the resources to build a physical wall, uh, especially during the pandemic. I felt like a virtual version of the Vietnam Memorial, but with added things like pictures and stories and a place for people to share messages would be the best alternative. And and people, there are loved ones who actually visit the virtual memorial. Uh, Almost, there's a few families who visit like on the anniversary of their loved one's birth or death. They regularly visit. So that's that's what my idea or my vision was.
Mhm. And that kind of speaks to the way that the website functions, which is, like a memorial wall, but almost like a place where people can virtually visit the story, at least of their loved one. It kind of speaks to COVID grief in a way, which is what we're going to be talking about today from a variety of different perspectives, because I think everyone, for example, your background, you're trained as an engineer, and so to you, building the wall was very important. To other people, art is important, and we're going to hear from people who have done other things to help remember those that we've lost to COVID. And one of the reasons why all of these things are important is because of the challenges of seeing loved ones die of COVID from you may think of your loved one perhaps might die in something more common like a car accident or a heart attack or cancer, but a worldwide pandemic, who expected that? Who kind of knew how to deal with that? And then, of course, it got a little bit, politicized, and there were people on sides, which made it all the harder to have people on two different sides. Um, and so the whole experience of losing someone didn't have, in many cases, that sort of finality or finalizing that comes with burial, a church service, and that sort of thing. And that's what makes it different. And of course, that's what we're going to talk about today. But um, I have to say that as dubious as I was when Muhammad started talking about a virtual wall, the fact that it scrolls, first of all, is something that really gives you more of an experience than just looking at a wall. We also have a blog, a news page, so that we share information as well about the pandemic, about the disease of COVID. And so hopefully that's helpful as well. Um, so I think that that's the thing that really makes me interested not just in our work, but in a number of other people's memorial work, is that COVID grief is just different. It just is different. And so with that, we're going to hear from Heather again. She's going to talk to us about the way that she has addressed the COVID grief and memorialized, helped to people to memorialize.
All right, I am going to go ahead and share my screen. I have a little presentation. Just let me know when you can see it.
We can see it.
All right,
Yep.
great. So again, my name is Heather Schulte. I am an artist. I live in Colorado. I am the founder and director of this project called Stitching the Situation. I'm very honored to be here today and to be able to share our work with you. My personal artwork is very much centered on language and communication and how these affect our relationships with ourselves, each other, and our world. And so it was not, this project wasn't something that I expected or planned to do, but I can see the connections it has with my own work as an artist. And as someone who's lost a family member to COVID, it like it related very much to the rhetoric and the contentiousness that cropped up surrounding facts and scientific data, which is really concerning because that contentiousness really centers political and economic interests over social and personal impacts that coronavirus has had on our health and our social emotional well-being, our relationships, all the ways we're human in the world. And so as our interactions were predominantly shifted to online platforms in 2020, in compensation for the social distancing we had to do, and these platforms are already notoriously divisive, opinion bubbles, I needed a new way to physically connect while isolated. And it became clear to me that this was an effort that was essential, at least for myself, and I know for the people that are part of the project. And what this project does is it has created space for us to come together safely in different ways as the pandemic transformed over time. It gives us time to contemplate information slowly and to form a collective material response and a personal record with our actual bodies, with our hands. And like I said, this project didn't start with any imagining of what it has now become. At the moment, it was simply a way for me to cope, and it has adapted along the way. So in March 2020, when I and my husband and my three kids were suddenly at home, my kids were schooling at home. I, as an artist, had lost access to materials and tools due to these stay-at-home measures, and my brain was really just maxed out with all that involved. So I turned to what was most familiar to me: a humble needle and thread and this length of fabric that I happened to have on hand. As reporting on the virus inundated us with numbers, data points, and statistics, much like Mohammed mentioned earlier, I needed a way to take those abstract numbers presented on this tiny screen, usually my phone, and I needed to make them tangible. So textiles gave me a way to touch that information and transform it into something I could hold in response to the people that I couldn't hold. Let's see. And then a little bit less than a month later, I received word that my Uncle Joe tested positive. He was living in a VA care home in Alabama. It was the first veterans facility in the state to report cases. They had tested everyone earlier in the week. I don't know what the timeline was specifically, but it takes multiple days at that point in time to get results back. He ended up dying on April 13th. And he was one of 35 residents in his home who were lost over the course of a month to the outbreak that infected 94 of the 143 veterans who were living there at the time, and some staff members as well. These infections and deaths happened just as the VA had established official protocols for testing, PPE reporting, and any kind of official COVID-19 data tracking within the VA system. In other words, it was too late for many of our elders and their caregivers to be protected. As too many know, it's so devastating to lose a loved one quickly, and incredibly more so when you can't be present to hold their hand or gather to console each other in sorrow. I didn't know when I started this project how it would carry me through my own pain and grief and provide space for others to connect and work through their own experiences. So the same week that my uncle tested positive, I was continuing to stitch the outlines of the data for each day of the pandemic. And during that week, I ended up filling up the length of fabric that I had on hand. And that really, both the fact that I had lost my uncle and the fact that these days, numbers of stitches were getting so unwieldy that I couldn't stitch them all myself, really showed me that I couldn't do this on my own. I couldn't cope with the pandemic. I couldn't manage this project. It all just pointed back to the needs of humans to be in community. And so I happened to be chatting with a neighbor about how we were all coping. And I mentioned the project that I was working on, doing all the stitching. And she expressed interest in helping, if possible. And I realized that the size of this project, like the physical size of this piece of fabric, was big enough that we could actually sit together outside and what's the word? Respect the COVID precautions that we needed to. So what ended up happening was I brought this panel of fabric out, and these are some photos. The bottom right is me and my neighbors with what ended up being 3 panels that represent the first 6 months of the pandemic. And so each of these little outlined areas that you can see represents one day of the pandemic. And those are filled in during community stitching sessions that started in my front yard with my neighbors. And it was a way for us to connect. It was a way for us to relate to these people whose lives are represented in these stitches, to relate to them physically with our bodies, in community with each other in a safe way during a time where we were largely separated. So another thing that this did was it enabled like this bodily recognition of scale was really important, because numbers, especially when you're interacting largely on a phone or a digital device, you can zoom in and out of maps, but the physical object that you're interacting with stays the same size. In contrast, this project, as you can see, just keeps getting bigger. So it mirrors the pandemic in that way. It's become larger than my physical body, but it's still, the stitches are small enough to where it's somewhat contained in a more reasonable fashion than something that might be on the scale of a human body. So these stitching sessions have traveled. I've conducted them in libraries, outside in parks, and different conferences across the US. And they provide space for communities of people to not only record this time through making together, but also to reflect on the myriad impacts of the virus and then discuss these topics with each other. So when I present at a conference, I will bring these pieces with me and invite people who are listening to stitch while they're, learning about this project and other writing that I've done about this work and the work of creating art together. And then in this particular instance, the performative act of stitching together ties to like the ancient practice of people creating textiles. Ancient and traditional indigenous traditions making clothing for rituals and celebration, include also medieval women documenting historic events like those depicted in the Bayeux Tapestry, quilting circles, people knitting socks for war efforts, flag making and banner making for protests. All these different kind of collective efforts bring people together to reckon with the impact of events in a physical way that's accessible and affordable for the most part, and allows individual voices to join in powerful solidarity, even while they all have different perspectives. Those perspectives can come together into pieces and projects. So by the time we reached the summer of 2020, on June 25th, I reached the end of the 3rd panel of fabric as cases were surging toward our big surge in the summer towards the middle end of the summer of 2020. And those panels that I was talking about measured a length of about 38 feet, which ironically is the circumference of a circle, where if you were in the middle, the radius would be about 6 feet, which just these numbers it's a funny thing to me that it coincided with the same distance. Like if I were at the center of a circle, 6 feet around me, if people were on that circumference, it would be the length of the total of the panels. So there's something about that number and the coordination of something I didn't plan, reflecting the numbers that were involved in social distancing. It felt like a really good time for me to shift this project in a new direction, because these panels become unwieldy when they get so large. And I was spending hours and hours each day stitching outlines. And as I said earlier, it was clear to me that I couldn't do this on my own. And that first iteration of community was stitching alongside other people. But it became clear in the summer of 2020 that the pandemic was ongoing and would be much larger than we had hoped it would become. And so another friend suggested that I um, consider help finding ways to distribute pieces. And so what I ended up doing was making kits that start with June 26th, and I mail them all over the US and to a few other additional countries. And the kits involve a piece of fabric with the outline of that day's data marked on it. You get the needle and enough thread to get started and instructions. And so there are now, let's see, I think about 450 people across the US that have a kit in their hands at their home. And we meet together online once a month via Zoom, sometimes in person. And we maintain a Facebook group and Instagram account where people post their stitching progress, share ideas, and we encourage one another and just kind of workshop both stitching issues and also how to, get through this time together. So the beauty of having people have the time to stitch on their own and the size of these pieces, when you're talking thousands of stitches, it's like the resolution of an image. A variety of hues and values of blue and red can enable really complex imagery to appear. And so this adds another layer of storytelling to just the raw data that's represented by each individual stitch, the blue stitches being the cases and the red stitches and pink stitches being the deaths represented, based on the Johns Hopkins coronavirus database. That's our data source. So within the context of each of these blocks and thousands of stitches, each stitcher can then create an image that reflects their own experience or perspective on the pandemic, or they can utilize it, like in the top left, to just spend the time making something that honors the lives represented. And that act of stitching itself and being in the moment helps people consider and process the pandemic. And most recently, the way that this project has adapted is a method I'm calling the story network. So what this project showed me over time was obviously stitching takes a long time. Not everyone can commit hours and hours to stitching. Some folks can't physically manage a small needle and stitches, or maybe visual acuity isn't what it needs to be able to see well enough to stitch. And so the accessibility to the project and the ability for people to tell their stories through it is very important. And so what we've done is we've created a way for folks to share their stories either via a Google form, an interview, video, audio, whatever it may be. And then we partner those people and their stories with an artist or a designer or illustrator to create an image or an illustration of their story. And then those images can very easily be turned into patterns. And those patterns are then stitched on a kit. So on the left here, you have a sketch of a design based on a friend of mine's story. And then on the right is the process of stitching, and then the picture of the kit in the middle, where the fabric is the background. So yeah, this entire project is purposely flexible and adaptable. It functions in a hybrid manner through in-person and online workshops, interviews, and presentations. I brought the project to communal living centers, libraries, parks, conferences, and more. And people are able to pick it up and put it down as they have time on their own schedule. You can submit stories or images online. You can collaborate remotely and ensure that the project's availability and spaces feels safe and comfortable to everyone. There's no time limits to complete a piece, or there's no deadlines. And there's not even a requirement to complete a full block. If folks are able to contribute the amount of stitches they can and then send it back, that's perfectly okay. Then someone else picks up where they left off and continues. It's really important to me that people are able to contribute what they can as they can and not feel any shame or regret if possible. We try to be as accepting and open as is possible.
And Heather, it's
Yeah.
2:44. So, it looks
okay.
like just wrapping up. Boy, you got good time.
Yep. So there's so much information available on our website, stitchingthesituation.org. We became a 501c3 at the end of last year. We are currently looking for a designer or working with some folks to reorganize the website because as this project has grown, it's like an unwieldy thing that I've tacked bits and pieces onto. So there is a page there that has each individual block that has been completed, where you can see the work that's been done and read more about each piece and what inspired it. We also have, as I mentioned before, an Instagram and Facebook page, Stitching the Situation. And you're welcome to reach out to me via email as well. And I believe next up we have, let's see, Megan. And Megan is joining us from New York City. She's part of Naming the Lost and will be discussing more. If Grace, you want to go ahead and highlight their screen, that would be great.
Hi, Megan. Thanks for being here.
Oh, thanks for having me. Can you hear me okay?
Yes.
Great. And I'm going to go ahead and share my screen so I can share lots of pictures with you all. Second. Okay, can you see okay?
Yes.
Okay. Hi, everyone. Thank you so much for inviting me to be part of this event. And thank you to Heather and Ruth and all of COVID-19 Wall of Memories for sharing your stories and your work. My name's Megan Paradis Hanley. My pronouns are she, her, and I'm calling today from Lenape land, also known as Brooklyn, New York. I'm here to share with you a little bit about a project I've been working on since May of 2020, naming the Lost Memorials. It's a real honor to share this history in dialogue with you all who have also been working to remember the hundreds of thousands of friends, family, and neighbors who died from COVID. I'm really grateful to be in relationship with you. So I'd like to tell you a little bit about this project. We are a small team of artists, activists, and folklorists who have been curating COVID-19 memorial sites in New York City since May of 2020. The project is currently sponsored by City Lore, Great Small Works, Mano a Mano, and Greenwood Cemetery, and funded by the Monuments Project, which is a special grant-making initiative of the Mellon Foundation. But when we started out, we were just a bunch of people who were at home, scared and needing community. So let me share a little bit of that story with you. So in May of 2020, Naming the Lost Memorials was founded as part of an online vigil event. This vigil was organized by community organizations such as Jews for Racial and Economic Justice, Make the Road New York, the Caring Majority, and others. And they planned a 24-hour vigil to read aloud the names of as many people as they could in that 24 hours who had died from COVID in the United States. This group also saw a real need for offline action. So they helped organize a group of volunteer artists and activists to set up physical memorials in each of the 5 boroughs of New York City. And so because of social distancing, there wasn't a real place for New Yorkers to come together to mourn at that time. So we made plans to set up 5 memorials over Memorial Day weekend. They were at the Jacobi Hospital in the Bronx, Greenwood Cemetery in Brooklyn, the Seward Park Extension in Manhattan, Corona Plaza in Queens, and at Verrazano Nursing Home. And here are a few pictures of those memorials. Jenny Romaine, one of our artists who's led the project from the beginning, and other artists affiliated with a cooperative space called Building Stories, worked together to paint banners reading Naming the Lost in the languages most commonly spoken in the neighborhoods where the memorials were being installed. And our first memorials featured individuals' names written on masks and pinned to fabric or to mesh so that they could be easily removed in case of bad weather or interference from security. At the time, we didn't seek permission for any of our public memorials, but as the project has continued and we've started building larger scale installations, we found that it's really helpful to build institutional partnerships. This helps the memorials be able to stay on view and stay very well cared for longer periods of time. So here's one of the photos of our memorial in the Bronx that first weekend. Here's one in Queens, which was more of a pop-up. It was part of Recovery for All action in Corona Plaza, planned by Make the Road New York. This was our first memorial at Greenwood Cemetery, and this is Alexa Aviles, who's now our city council person and who also lost several family members to COVID. So one of the really important aspects of these public memorials was that we always left space on the fence for people to add their own remembrances. And we'd leave art materials available so that people could make an art piece and pin it to the fence. So people started immediately creating work out of simple homemade materials that they could include on our memorials. So following those first memorials, we started receiving invitations from community groups around the city to partner with them to curate spaces for COVID remembrance in the midst of other organizing. So we set up a memorial altar at an action in July 2020 to fund excluded workers, people who weren't included in some of the emergency aid of that year, and in a nursing home in Manhattan, the Isabella Center. In September of that year, we planned a distributed action where we created a memorial making toolkit, and then we shared it with individuals all around the United States to set up memorials in their own homes, neighborhoods, and public spaces. And then in October, we started partnering with Mano a Mano, Mexican Culture Without Borders, to plan a Day of the Dead memorial, starting at St. Mark's Church in the Bowery in Manhattan. And then we worked with Bronx Documentary Center to make an ofrenda and a digital memorial in their storefront space. And then it got very cold and wet, and all of our memorials take place outside. So we went into hibernation until spring. But starting in March, we joined forces with the Caring Majority to create a memorial honoring the at least 15,000, certainly many more people who died in nursing homes in New York State. It's worth remembering, if there are any New Yorkers listening, that then Governor Cuomo decided to take people who were sick with COVID in hospitals and return them out of the hospitals and back into nursing homes, which endangered the lives, led to the huge loss of life from thousands of vulnerable people in nursing homes. So if you are a New York City voter, I encourage you to remember that when you vote in this year's mayoral primary. We continued working together, and in June of that year, we decided to plan our first community memorial. Our sense at the time was that there weren't enough spaces for New Yorkers who had had really different experiences of early pandemic to come together and to mourn side by side. So we invited 20 community-based groups to contribute to this memorial. And we set up an art studio in Greenwood Cemetery's historic chapel so that people could sit together and make art honoring their loved ones. And then we installed all of the artwork on the Greenwood fence. We also started holding activation ceremonies, which was a chance to bring together music, dance, and ritual to dedicate the memorial and to make it a space not just for the dead, but also for the living. And then we took a pause from the project. Vaccines had just become widely available, and I think I was optimistic that that COVID was behind us. But some of our other project leaders, including folklorist Kay Turner, who's in the foreground here, and Steve Zeitlin of City Lore, had the insight that the spaces of remembrance would continue to be necessary. So Steve and Kay approached the Monuments Project and applied for a major grant to support the project's continuation. Long story short, we received the grant, and that's allowed us to turn our scrappy volunteer effort into a scrappy, large-scale funded effort. And so each year, Naming the Lost is able to invite and pay up to 30 community-based organizations to participate in our project. We prioritize representation from groups from each of the 5 boroughs, and we invite groups whose members and neighborhoods were particularly hard hit by COVID-19. We hold community workshops in each borough so that we can plan the memorial together. We hand out free materials that can withstand weeks of rain, snow, wind, and sunlight outside. And we teach different techniques so that a lead artist from each group can take that back to their communities and lead in the construction of a community memorial. We also dig deep into each year's theme. So in 2024, we borrowed from disability justice writer Leah Lakshmi Piepsna Samarasinha, who said, "Everyone is holding so much grief right now and it's so hard, but it's created this bigger, slower, majestic space to be real with what's going on and organize from that space." So this led to what we called the Big, Slow, Majestic COVID Memorial, and here are how 2 groups interpreted that theme. I'm going to show you a couple images from our recent memorials and let the partners' work speak for itself. So here are a few images of the work that people have created as part of this project. This was from a memorial that we called The Many Losses of COVID-19, and it took place at Greenwood Cemetery. We continue to hold activation ceremonies, which is where we invite artists from different traditions to lead us in song, dance, and ritual. And each year we continue to work with Mano a Mano at their Day of the Dead celebration. So we gather at the cemetery at St. Mark's Church in the Bowery, create a memorial together, and honor the dead. And I really wanted to highlight this memorial piece, which was created by the group Archive-Based Creative Arts, which is made up of folks from inside the prison system and formerly incarcerated folks. This particular memorial featured the stories of people on the inside who survived the pandemic while incarcerated. And Willie Kearse, who's a leader in archive-based creative arts, shares that folks in prison weren't given masks or allowed to distance from each other, and guards weren't taking very many precautions to avoid passing COVID on to the folks on the inside. So archive-based creative arts has been uplifting the incredible stories of survival and ingenuity from people on the inside. So our work of memorializing continues through the end of this year. Each year we create 2 large community memorials, and more than 95 groups have participated in the project all told. We don't tell each partner group how to design their piece of the memorial, so the result is an assemblage, many different voices speaking together in a chorus. At the end of this project, the New York Historical Society is going to preserve selected artwork for future research and possible display, and our digital archive will be available on our website, ntlm.org. It's also being preserved as a whole by the Library of Congress, thanks to City Lore's efforts. But our project is coming to a close at the end of 2025. We always imagined that these memorials would be ephemeral sites of mourning, and there are many other groups working on a more permanent COVID memorial, and I hope they'll succeed. But our focus has always been on creating memorial sites that are grassroots, simple, easily accessible, and that allow anyone to contribute as an artist. So COVID-19 is still with us and will continue to be part of our lives. And this project has hopefully provided a bridge for folks to move through and process the trauma and isolation of 2020. And in the meantime, our project continues through the end of this year. So each year we've been speaking aloud the names of our loved ones, sitting together, making art and swapping stories. And with our final memorials this year taking place at Greenwood Cemetery in May and in Manhattan St. Mark's Church in New York, I hope if you are around, you will join us. And if you'd like to be in touch, you can find us at ntlm.org or on Instagram. Our handle is Naming the Lost Memorials. Thanks for the opportunity to share today, and thank you for all of your work.
Thank you, Megan. That if someone who lived in New York for 7 years, that can't have been easy, I know. But it seems to me there was so much loss in such short a time in New York. And I think that the work that you've done and that the people you've partnered with have done kind of matches, I think, the intensity of the loss. So yeah, I'm really impressed by it. We should be joined shortly by our next and final speaker, Marcos Lutchins. And before he gets here, I will just tell you a little bit about him. He is an artist who's really known around the world because he travels around the world doing all kinds of projects and has in the last few years focused on COVID to a great extent, including a collaboration with the World Health Organization. And he's also, well, he'll talk more about, I don't want to blow his presentation, but one of the projects that he's worked on is the Rose River projects. And we in Houston, COVID-19 Wall of Memories, actually worked with him in producing one of those. And I I don't have photos handy of those, but Mohammed, if you have one handy, you can share it. Basically, what it is, the project is, in essence, handmade felt red roses that, for example, in Houston, we made about 12,000 because at that time, that was about how many people had passed away from COVID in the greater Houston area. And we needed to, every project is different. So we needed to find a place where we could appropriately display these roses. And so we decided on Tranquility Park in Houston, which is across the street from City Hall. And there's like a little hill, a little mound there. And so we created a stand. And Mohammed, what was it that the stand was created out of?
PVC pipes.
PVC pipe and hand cut by Muhammad himself. Thank you. You're about to share a photo, I see. Yeah. So then we just kind of took that space and with Marcos's input, created, essentially a what would you call it? A rose-based memorial. And it was there for the entire weekend. It was up and in the I guess it was the second day that the installation was there. We had a program that included speakers, that included family members who had lost loved ones to COVID. We had several elected officials, including city council members and county officials, speak, and it was overall just it was exhilarating, I think, to be in this space with people who kind of had um, not a shared interest, but shared concern, shared loss. And it was a really interesting way to sort of remember people who had passed away from COVID. So we really enjoyed that project. And he has, as I said, produced this in all different ways. It's been on the front of buildings, and multiple different configurations. So the Rose River Memorial, and that's just one of the works that he done, and here he is now. So we'll introduce Marcos while he's connecting to audio. Hi, Marcos.
Hi there.
You don't have
Nice.
to present. I just did your whole, no, I'm kidding. So I was just talking a little bit while we were waiting for you to get here. I was talked a little bit about the Rose
Right,
River
right.
Memorial and showed the one that we did in Houston. So, and I described you, so I won't go into a lengthy additional introduction, but basically you are a world-renowned artist who has done a number of COVID sort of based pro projects and collaborations, and I will let you take it from there.
Yeah, so I am very honored to present today. Thank you, Ruth, and thank you, Mohammed, and the COVID-19 Wall of Memories and all the partners. Um, as Ruth says, I've worked a lot with memorialization since the beginning of COVID. To start with, I did these kind of hypnotherapy sessions for friends and people who joined from around the world on this new platform called Zoom. And then after about 12 weeks and realizing that the COVID pandemic was just getting worse and worse, I turned my interests, I suppose, my focus to memorializing by making one rose for each person that had died from COVID. And as Ruth probably said, we did an incredible memorial in Tranquility Park in the center of Houston, among other places. We also worked around the different parts of the US doing these presentations, these installations with lots and lots of roses. And many of the roses were actually made in Houston and representing the 14,000 or so people that had died from COVID there. I actually still have the roses, and I would love to show them somewhere soon. And again, especially on this 5th anniversary of the start of COVID. One of the issues about making physical roses was the fact that in the United States, I think it was 1.2 million people, or perhaps more, died from COVID. So I turned my attention to making perhaps these kind of digital version of the roses, which were in kind of augmented reality, a kind of digital interface um, that was married to a physical installation. And I began to work with the World Health Organization about a year and a half ago to begin to propagate that proposal, that project, to different places around the world. And I think we're going to see a short 2-minute video of that. Is that correct?
Yep. Let me just.
So if we're ready.
Yes. Let me just try to get it started and then share screen as quickly as possible.
Right. Yeah, so there's just a feeling of, I think we have to rewind it.
Oh, I'm sorry.
Who are we doing the project?
Yeah. Give me 1 second. Sorry about that. Can you hear it okay?
There's just a feeling of, who are we doing the project for? Are we doing it for WHO to like highlight their pandemic accord, or are we doing it, as a tribute to the 7 or 8 million people that died from COVID around the world? Or are we doing it for the frontline workers that lost their loved ones and then lost them, other frontline workers during the pandemic? Is this a project that is kind of more as a kind of warning to future generations about what can happen and what to avoid? All these questions. We came across this kind of symbol of the rose, which is used in American funerals a lot. And it's actually a kind of universal symbol of love, but also in many cases, remembrance. And so we started making more and more of these roses with the community, and the project kept growing and growing, and it began to spread to different states. I thought that we could transform this physical rose, this felt rose, into a digital version of a rose, and then have an augmented reality installation where these digital roses would rise up from the map of the globe, again, taking the project from the scale of the United States to the scale of the world, and then have these roses rise up from the center, rising up in a beautiful spiral. And each rose would represent one person that had died from COVID. So the film actually kind of started halfway through and then it rewound a bit. So, but it is a work in progress documentary that we're making about the World Health Organization project, also with its kind of base in the Rose River Memorial, part of which was shown in Houston. So we're working to hopefully finish that soon and present it, hopefully with the WHO. It's a really challenging times right now, could I say? And I think it's very, very important to help memorialize the pandemic so that especially it won't happen in the future. The World Health Organization was working on signing a World Pandemic Accord with 196 different countries. But in the current climate, who knows if that's going to happen. However, I think it's up to us as individuals and also as communities in different parts of the United States and the world to stick together and help memorialize not just for the families that have lost loved ones, but also, as that film says, to help prevent the next pandemic, which could be prevented, I think, with concerted action. So that's I think most of what I wanted to present. Do you have any questions, Mohammed or Ruth? Or
Mohammed, You looked like you had something to say. I don't want to
No,
step on your toes. Okay. Um, well, you had shown very briefly in that video something on the phone that, I don't know if that's what you were talking about was cut off from the video. So I don't know if you wanted to talk about that or if that's still under wraps or
Sure, no, it's not under wraps.
okay.
And again, the video seemed a little bit disjointed, but because it kind of started halfway through, but the technology that we used is called augmented reality, and what we did was create a view through your cell phone. The cell phones and tablets were generally used in COVID, unfortunately, to say goodbye to loved ones that family members couldn't interact with directly. So we thought the phone would be a good medium to memorialize in this particular case. So opening your phone, you pointed at a QR code, and then you pointed at this kind of circular map of the world. You may have seen me unfold something in the video. And it's a map of the world, quilted map of the world made by immigrant volunteers in Missouri. And then from the center of that physical real map rise these digital roses that you can see in your cell phone. And if you tap on the roses, individual family members, people that have died from COVID appear with their name, a photograph, their dates of birth and death, and they rise up. And you can tap different roses, and you can also search for loved ones. And that's a technology that could perhaps be used in future memorials, and we've been possibly discussing integrating something like that without the roses, but it's something like that into this Houston memorial that we've been working on, that the jury's still out as to whether we're going to use that augmented reality or not. But it is definitely a tool that could be useful to help.
Yeah, that's amazing. I actually wanted to see, I don't know if I can do it in the time we have, but I want to see if I could find just that portion of the video where you can see it. But the way you described it is, yeah, very apt. It just looks like roses floating up, and it's really amazing. So you can just,
Thanks, Ruth.
that QR code.
Well, we hope to have the documentary done relatively soon, and
Yeah.
perhaps we could screen it in Houston one of these days to the community there. And I think it will tie into all our efforts together. And we actually, some of the people in that were digitally represented in this augmented reality interface were shared with us thanks to COVID-19 Wall of Memories. So we're grateful, very grateful for that.
Grateful to you. Did you have anything, Mohammed? If
No,
that,
the only thing that I was wondering was we have a 1 minute video of this proposed physical
oh,
memorial, the Greater Houston COVID Memorial, that will be here in Houston. And Marcos is the one who came up with the concept of that teardrop shape. And
yeah.
so can we share that 1 minute video?
Oh, I
So,
don't,
if you have it,
yeah, I don't have it handy. I didn't think we were going
well,
to talk about it, but
yeah, we can describe it verbally. I mean,
yes.
Mohammed already made a good um, effort at describing it. It's a large monumental sculpture. It's physical. It's a place that family members can come and gather around, and it is in the shape of a teardrop, which is, perhaps a way to help process grief. But there's also this feeling of honoring all the loved ones. So hopefully it's also uplifting and a place where we can congregate and come together. And around the base, there'll be some words, probably submitted from local poets to resonate with the feelings of grief and hope related to this COVID memorialization efforts, our efforts
Yeah.
within the Greater Houston area, which memorialize about 14,000 people.
Yeah. That's a long-term project.
Mm.
So thank you so much, Marcos, for being here and
Yeah,
for
thank
the
you.
work that you do. And I think Heather is going to close us out. But I just want to say that what you've done also is really amazing. Listening to your presentation, I understood a little bit better what you were telling me verbally about how your work is done. And I think I also told you that I couldn't do it because I would need too many band-aids. So, but I'm really impressed, the creativity, the same with Marcos and with Megan, the creativity that goes into that is just really remarkable. So thank you. And I'm sorry about your uncle as
Yeah.
well.
And I understood now what your project is, and I want to get a kit.
There you go.
I can send you one.
There you go. All
Yeah,
right. So
because that
Heather,
sounds like I've never done anything like this. So would I still be able to do it?
Absolutely. So I have, with our local library, I produced a series of how-to videos on how to cross stitch. And then there's also just a page on the website on how to start working on a kit and all that kind of stuff. And now with this story network, we're working on providing kits with a pattern. So we don't have very many of those yet. It's a process that we're bulking up, but that way, folks who might not have the skill set to actually design a complete pattern can then just follow the instructions. As
Hmm.
most cross stitch kits and stuff like that you get at a store, or from a independent artist designer, it would come with the pattern and the thread and all that stuff.
Yeah,
So
I'd love to do
yeah.
that.
It, honestly, it's one of the very first things I learned how to do creatively as a child. I grew up with a mom who's very crafty and a dad who's an engineer, and so we were making a lot of things at home, and cross stitch is one of the first things. So it's fun to think about how that ties into like trying to find a source of comfort too in the midst of the chaos of lockdown and things like that. It sent me back to my roots. Um, Thank you, Marcos and Megan, for sharing about your amazing work. Marcos, I'd love to hear. Do have one question for you: how you got involved with the WHO?
Through a friend called Manish Uprati in New Delhi, who introduced me to somebody in the World Health Organization in Denmark, Roy Wiada. And then he introduced me to I suppose, the people, Paul Garwood, who's Dr. Tedros, who's the general manager of the WHO, his I suppose, right-hand person, who was brought the project to Dr. Tedros, the general manager of the WHO, and he was excited by the prospects of being able to kind of give a kind of physical manifestation of what is often in the WHO and big organizations like this, but paperwork and contracts, and it's very abstract. So I think
Mhm.
they thought that it was good to have a physical memorial that could be in the present. And we kicked it off in Central Park with the UN um, what do you call it? When general gathering,
Meeting or assembly or something.
the assembly, the
Yeah.
UNGA in September of 2023. And so we kicked it off in Central Park, and then we took the project to different places like Aguascalientes in Mexico and New Delhi in India and Rio de Janeiro in Brazil, and then um, ending up in Geneva after going through London and Venice in Italy and Hanover in Germany. So, we took it around to quite a few places, which was the idea was to for the project to be multicultural
Mhm.
and work with different communities and hospitals. And we also collaborated with the with the World Scrub Choir, who made these songs during COVID times to help nurture people throughout COVID. And they're a choir made of singers who are healthcare professionals from around the world.
Mhm.
So we were honored to work with them too.
Yeah, that's lovely. Um, So I do also want to mention, as we're closing up here, Scott Gabriel Knowles was unable to join us today. But his podcast, COVID Calls, was in existence for, I want to say, 4 years, and don't quote me on that. I know he has over 500 episodes of different discussions that he had with people from all different sectors, talking about COVID and how it impacted all sorts of different jobs and aspects of our lives. He talked to healthcare workers, academics, policymakers, researchers, as well as writers and creatives. I, full disclosure, was also on his podcast a couple times, and other folks who are working to memorialize and archive this pandemic. And I'd really, really encourage you to go check out his archive, as it's a rich resource of very kind of global perspectives and not just in the world sense, but also in the various different perspectives of different sectors of how this pandemic impacted our lives. So I'd also like to just emphasize that our 4 projects that we've discussed here today are 4 of many projects doing this work. Some of them are easily found via online searches, and some have been highlighted on news sites and well advertised and probably better funded, definitely better funded than mine. And others are small endeavors that might be just temporary, but those also nevertheless served an important purpose as spaces to gather and grieve. And all this to say that even though I still see people asking, where are the COVID memorials online and in various news media, including today's New York Times, I will say, we're here. We're out here. We've been here. We've been at work. We're doing it, whether it's noticed or recognized widely or not, because we care. And I encourage all of you who see this video to take some time to delve into the project, or maybe a project that resonates with you, and consider contributing to the ongoing efforts to ensure that people we have lost are not forgotten. That could be a stitch, as in my case, financial donations, or even just some of the behind the scenes support of tech and those kinds of things. Every little bit counts, and it's the combined efforts that really make these projects sing. It's our hope that these help us as societies to remember and apply the lessons we've learned from this pandemic to be able to prevent, hopefully, another one, or better respond to crises in the future. As we close out, just want to thank Ruth and Mohammed and COVID-19 Wall of Memories for hosting us today on your platform. And thank you again to Megan and Marcus for sharing your work. I'm honored to be in the company of many others who care passionately about and for the COVID bereaved community, and making sure that these times and these experiences aren't forgotten. Mohammed, did you need to say something?
Yeah, there was a question on
Oh,
Facebook for
great.
you. It says, "Hi Heather, what was the name of the podcast you mentioned?"
Oh, the podcast is called COVID Calls. And I know their archive is hosted on Podbean, but you can also find it on Apple Podcasts and I think maybe SoundCloud as well. I'm not sure if it's on all of the things, but a Google search should get you there.
Thank you. And Heather, tell us again your website is.
The website for our project is stitchingthesituation.org.
Okay. And of course, we're at COVID-19 wallofmemories.org, and we're also a 501c3 and can use any support that people would like to share for, it's just one project of many that remembers people who died of COVID. And that's so important. And we've seen today how many different ways people do that. So thank you to Mohammed, you had something?
Yeah, I would like to mention that if you or anyone that you know who has lost a loved one to COVID, we would be honored and to be given the opportunity to honor them on this virtual memorial. So you can go to www.covid19wallofmemories.org, and on the launch page, There's a button on the top. It says share your loved one story. You can click on it. It opens up a small, simple form to fill out the information, upload a picture, and your job is done. It will take over from there. So thank you.
Yeah, thanks for mentioning that, Mohammed. And thanks for everyone who watched today. Thanks to everyone who will be watching the recording on YouTube. We'll be there shortly later today. And it's been a pleasure to meet, my fellow COVID rememberers. And it's been Heather, especially you. It was great to get to know you. And thank you so much for working on this project and for collaborating on it. Appreciate it. And
Yeah,
with
I want to
that,
go to Rio with the
and
Marcos.
yeah, there you go. So with that, thanks again to everyone who's watching and have a good afternoon. Bye.
Goodbye. Thank you.
Thank
Thanks.
you.